Could it happen to you? We're talking about conditions that just may take you by surprise. But Jim always knew his cocaine addiction was causing collateral damage. He just didn't know how much.
I always felt like the outsider. I always felt like something wasn't connecting right with me. So one evening I'm at a high school party, about 17 years old, and I had a couple beers, and I found like this is the solution to my problems. I found my way out of my insecurity. So I'm in college now, and I had to make all new friends. I drank a lot. I got in a lot of trouble from drinking. I started using cocaine. It was around a lot more than it had been in high school. The cocaine grabbed me, and it didn't let go. About 13 years ago, I met a drug dealer, and so I now had access to cocaine at any time I wanted it. I was able to call this guy every week, and what turned into a weekly habit turned into a daily habit. At first, I was doing cocaine with my friends. It was kind of the party scene. But it was just a matter of time before I was doing it by myself. My addiction was affecting my life, it was affecting my marriage, it was affecting my relationship with my child, it was affecting my relationships with friends, and most importantly, with my family.
I think the hardest part was just not knowing what to do, and still loving him and not wanting to abandon him, but yet. I was always begging and trying to encourage him to stop and to get help. I could tell physically he was in pain, and he looked terrible. He was emaciated, and I know mentally he was not there, and he just changed. He was just a different person. He was not the man that I knew. He was almost like a stranger.
So I went in and out of rehab a total of 5 times. So through my recovery, I've been cleaning up the mess, the wreckage of my past. So one of the things that I want to clean up is all the physical damage I've done to myself. I've hit rock bottom, and I know what it's like to be a prisoner to drugs and alcohol. But if I can make it into recovery, anyone can.
I introduced Jim to a colleague, Dr. Jay Calvert, who set out entirely to reconstruct Jim's nose. Let's take a look at what he did.
Well, we're taking out the 8th rib because this gives a large amount of material, and it's fairly easy to harvest. That's actually a pretty good rib.
Yeah.
Now we're going to harvest the 9th rib. Make sure that I have the piece I need to hold up the tip.
So now we're going to check to see that we didn't get in the chest by filling the wound with water and inflating the lungs.
No bubbles, no injury.
This strut of cartilage will be used for the post that will hold up the tip of the nose. So next I'm going to remove the deep temporalis fascia through a small incision over the right ear. There is no support to the structures left in this nose, so we're going to make stuff to hold it up. I'm going to cut large dorsal reconstruction grafts. They're grafts to make the bridge of the nose, along with some other cartilage grafts which will be designed to keep the tip in position and support the nostrils.
Yeah, these 2 grafts together are going to make the bridge.
Now I'm going to burr down the anterior nasal spine.
So these are going underneath the nasal bones.
So I now have reconstructed the bridge of the nose, and I'm going to put in a strut of cartilage to hold it up. I'm going to place that strut in between the 2 bridge reconstruction grafts. And we can really see that there's a nose in here coming out. So next I'm going to lengthen the nose by putting in a columellar strut that will also function to bring the length of the nose down the face. His cartilage is really behaving nicely for this case. We're really getting a nice reconstruction because the cartilage is cooperating. So this is going to be the nostril reconstruction graft that we're putting now. Seriously, closing this thing is not going to be easy. This is the dice cartilage. We will take this cartilage and then wrap it in the fascia. So this is the fascia graft. By putting in the fascia with the dice cartilage, we fill all that in and smooth out the bridge of the nose. It's sort of like spackle for the bridge of the nose. So we are going to slide the dice cartilage with fascia graft into position, and this will reconstruct the bridge. The cartilage that we used was really quite good, and the grafts settled in place perfectly. I think Jim's going to be really happy with the results. He's just got to heal it up now.
Amazing stuff, Dr. Jay Calvert and his team. They're all here. Fellow plastic surgeon Dr. Ritu Chopra, who harvested one of Jim's ribs, as well as colleague Dr. Mark Kam, an otolaryngologist. Welcome to all of you. Just an amazing surgery.
You know, as a plastic surgeon, I can appreciate the complexity of this type of, I mean, truly a total nasal reconstruction. But in your mind, what was the toughest part of this case?
Well, the toughest part is dealing with the soft tissue envelope, the skin and what's left of the lining of the nose, because it's all destroyed. And to really get that to cooperate and to come off of his face was like trying to get brick to move.
See, you have to understand that it's two parts. You lose the inner support, but as part of that, the soft tissue, like you said, the skin itself shrinks down. It's very hard to expand, what is essentially scar tissue.
Absolutely, and there's no way to make that work unless you're going to really baby the tissue out and put in the right support, which is why we needed rib. Thanks to Dr. Chopra for helping me out to get that rib out of there.
He's good at finding that rib, isn't he?
He is.
People used to get cartilage from the ear, but it was too flimsy. And now with Dr. Calvert's technique, the rib provides support, and it provides a lot of it.
And Dr. Cam, when you first saw Jim and looked inside his nose, what was there?
He had a silicone button, a large piece of silicone that was replacing the septum, because the septum had been eroded from previous trauma and the use of cocaine. And there was a lot of infection. We could just see the green drainage and the crusting that was in there. And knowing that Dr. Calvert was going to be putting in a graft, there was the best way to maximize a positive outcome was to make sure that any infection that was there will be cleared out. And so we enlarged the sinuses, removed the chronic infection, and removed that septal button, which was giving him a lot of problems.
Yeah. Dr. K makes a great point. Is getting that pus out of there. Nobody wants to put fresh cartilage grafts into sewage. It's just not good. You know, that's literally what it is. It's terrible.
That was pretty descriptive.
Thank you. I think that brings it home for everybody when you see it that way. Yeah.
Well, this was not an easy surgery. Is everyone ready to see Jim's new nose?
Yes.
Well, it's been almost 4 weeks since the surgery. Jim, come on out.
So how do you feel? You look great.
I feel great. I really do. I feel wonderful.
And I hope you're not too sore, Jim, because I do want to do this.
That's okay.
I mean, that shot that we did, that Dr. Calvert did in surgery, and then you had no support to your nose. Now that I push, I mean, that nose is not going anywhere.
Right.
That's
good. That's good.
So I want to take a look at the way your nose looked before and compare it to how you look now.
Sure.
So let's take a look. There's your nose before.
Okay.
And side to side.
Oh, wow.
A strong, masculine nose, his own tissue, and still healing.
It's early, but you know, the structure is there, and probably one more smaller operation later this year to really finish it up. But he's doing. I mean, this guy's incredible.
Your magazine, Renew, is sending a great message, and keep up the good work.
Well, thanks. I appreciate it. Well, just the magazine's really, it's about showing people that recovery is possible. And with over 20 million people living in recovery, I think what better than to have a magazine that could really help them enhance their lives and show them ways that they can improve their lives.
And Jim, you're also standing here before everyone saying, look, if I hadn't done this, I wouldn't be here on stage having to go through all of these procedures, all the pain.
Right.
And so it's the other message there is by bravely coming out here. It's, look, you know, you don't have to go through all of this.
Right.
But if you have struggled, your magazine is about renewing. And I can tell you this, your nose looks like new.
Well, thank you. I appreciate it. I feel great.
Great job, Dr.
I get asked about a lot is, what is the long-term effects of cocaine use on your nose? I was a cocaine addict for a very long time. I finally got sober in 2017, July 25th. Cocaine was a hard battle for me. I did so much of the drugs, and it did cause a lot of damage to my nose. And I get asked a lot, like, hey, what were these long-term effects that you got from using cocaine? These are the effects. This is what I experienced after getting sober from cocaine, but doing 1 to 2 8 balls a day of coke for a couple years. This is what I live with now. If you're new to the channel, hit the like and subscribe button. And my name is Eric. I'm not a therapist or a doctor of any sort. I just share a lot of experiences. I'm diagnosed with ADHD, PTSD, GAD, MDD, level 1 autism. I've self-harmed before, lost a wife and a father to suicide, almost lost myself to suicide. And I am a recovering cocaine and alcoholic addict. I get asked a lot, what was it like afterwards of having cocaine struggles and using cocaine? What happened to your nose? Like, what are some of the long-term effects that you've realized and you've noticed from cocaine use? And this is what I've noticed One of the big ones is that's not nose related per se, but I do notice is my lungs. It has affected my lungs in a sense. I did smoke for a very long time. I just quit last year. That has something to do with it, but I also know that the cocaine use itself did damage my lungs some. It did damage my ability to breathe as good as I used to be able to breathe. It's not the same. I can tell you that for a fact. Now, I did get a lot of damage though done to my nose. And I've even had doctors who will ask me about my nose and how my breathing is. Here's what I've noticed though. One, I'm very, very sensitive to changes in the environment now. I used to never have any kind of sinus issues. I never got stuffed up. I was super duper healthy for the longest time. One of the things though now is, man, when spring hits, when fall hits, when summer hits, when winter hits, there's always something in the nose that I constantly have draining from my sinuses into my nose. So I'm constantly sniffing. And the thing that kind of sucks is when you're constantly sniffing or there's a shift or there's something blooming and your sinuses are out of control, you can't stop the draining, everyone still goes, oh, well, you're sniffing a lot. You must be using. No, actually, when you're using, you don't sniff a whole lot because this is all clogged. But I get what you're trying to say. Don't be a professional on this. You actually burn in holes up here into your sinus area and into your sinus cavities, and your sinus fluids just drip, and it's horrible because it's ruined my sense of smell. My sense of smell is shot. I do not have a good sense of smell. So when it comes to people will say, oh, do you smell that? I have to get my face jammed up into it to try and remotely smell anything because my sense of smell is so damaged. There are certain smells too that are extremely strong all of a sudden that can make me sick. So it's really thrown my sense of smell into a loop where with so much I can't smell, and then some of the things I don't want to smell, I do smell. So it's really screwed up the sense of smell. The other problem is it's affected my sleep because of my breathing. I don't breathe out of my nose very well anymore, and because of how the sinuses drip, especially at night, and I like to have the bedroom window open, so you always got stuff that's coming inside when it comes to just the season change and how it affects your sinuses, that I breathe out of my mouth. I am a mouth breather when I sleep now, which means I can snore very easily. If I get lodged on my back, I snore, and when I snore, I don't sleep good. So it affects my sleep because I breathe so much now out of my mouth and not out of my nose. Trying to breathe out of my nose, it's it's always clogged. Very rarely do I ever feel that my nose is free to breathe. And if it is, it's only for a short instance. And it's horrible because I notice it when my nose is actually clear now versus any time before, because there's these rare moments where I'm oh my goodness, I can breathe, and it goes away really quick because it's damaged so much up here. We don't realize how much our sinuses drain and how much fluid actually goes through your nose. And it all just comes straight down. There's nothing like sitting there and talking to somebody and your nose just starts dripping. I've had that happen a few times, and it's kind of embarrassing. I learned to own it and just be well, I guess it's due to all the cocaine use, and it's true. It's due to all the cocaine use that I did. But it's really jacked up how much my nose will drip. It also affects the membrane walls in your nose and in your nasal cavity. So those cavities are actually pretty thin, so I can get nosebleeds really easily. If I blow my nose too hard, I can get a nosebleed very easily. I used to have a really durable nose as a kid, and I don't have a durable nose as a kid anymore, and nosebleeds are horrible. If you sit there and you try really hard and you know you have something up there and you're just blowing and blowing, I can rupture the sides of my nose, and I can feel in there the thinness, and sometimes it gets really sensitive in my nose, and that sensitivity just becomes a pain. So you kind of have this pain that's in this nose area, and you constantly feel your nose now. It's one of the things I never expected that from cocaine use. I never expected it to actually truly damage my nose and my breathing, but it has. Because you're just, all you think about, especially when you're using, is the high, getting high. You don't think of the repercussions down the road and how much it really does jack up your sense of smell. I mean, it's one of your major senses, and it's horrible when you can't smell. It's horrible when your nose just starts randomly bleeding. And it's bad because you don't realize it sometimes when your nose is bleeding. I woke up in the middle of the night because my pillow's warm, or my pillow is cold even, and next thing I know, it's blood because I ended up having a nosebleed in the middle of the night, not realize it's so jacked up in the way that can't smell, always kind of clogged, always blowing my nose. And the bad thing is you don't really even want to pick your nose or do anything of that sort, because if you do, you're going to rupture and tear the side of it, and now you have a nosebleed. Now you have a mess on your hands. And let's face it, especially as guys, we don't carry around with us napkins everywhere. We don't carry around tissues everywhere. So you're just constantly like trying to clean your nose. And even when it randomly drips because your sinuses now are whacked out and it's just dripping down, next thing you know, you're constantly like this thinking you have a nosebleed, and you don't have a nosebleed, but you're always under that constant paranoia of it. You're also really susceptible to sinus infections. It's not uncommon. I mean, in the shower, my nose clears out because of that humidity in the shower. Man, I will literally blow my nose in the shower. It's one of the few times I can like clear this all out. And there's a lot of times blood and stuff in the mucus of the sinuses, just because I do have sinus infections now that I can get pretty easily. And again, it's all due to the damage that it caused by snorting cocaine. We don't think about it at all. And then later on in life, we're like, man, why do I have these problems? And you go to the doctor, and the doctor goes, yeah, you kind of did it to yourself. So these are what I've noticed of what my long-term effects of cocaine use is. I was doing 1 to 2 8 balls of coke a day straight for a little over a year. Very expensive habit, and the damage that it did, definitely not worth it. I mean, I lost a lot of money in it. I lost a job in it. I lost a lot. And that's the worst thing about drug addiction, is you lose so much and you don't realize what you're losing in life and the struggle that it is of loss. So if you're out there struggling, I mean, my heart goes out to you. I know what that battle's like. If you want to know what the first step is, just tell everybody that you're an addict. Tell everybody you're an addict and you need help. Just swallow that pride. I'm an addict. I need help. And the worst part is, too, is if you're not an addict and you have a friend or a family member or a loved one in your family that is an addict, you can't get them sober. They have to hit that point of rock bottom. They can't be enabled. You can't let them manipulate anymore. You know, you have to hit that point where you wake up and that person, that individual literally goes, I can't do this anymore. I want this pain to stop, and start seeking help. And where can you seek help? I mean, I got links down below to NA and AA. That's where I started off at getting sober. It was a battle for me. I did go through cocaine withdrawals, even with the restless legs. There's a lot of different withdrawal symptoms I went through, but I also now deal with long-term damage. And that all has to do with this whole beauty up here of the damage that I caused to it by snorting cocaine.
Кокаин страшная сила, понимаете, поэтому у него явные проблемы с восприятием реальности.
Perhaps one can end up with a almost boxer type appearance. Iris, scissors, please. I've seen patients where the whole middle of the nose is, you've just got one big nasal cavity and everything could just collapse. Okay, so what we see here inside the nose, here's the lining on one side. You can see the hole through the lining. So initially, the cocaine...
Ironically, Mr. Porn actually administers cocaine to the patient to stop bleeding.
Patients don't snort it up beforehand.
Все? Всем все ясно? Знаете, когда у нас все спокойно, размеренно, стабильно, нам скучно. Застой. Хочется движухи. Как только начинается движуха, все свистит у виска. И секунды, и пули, к сожалению, и пули сейчас свистят. Так нам страшно. Ужас, ужас. Ну, ужас. Но не ужас, ужас, ужас. Все...
Веселый порошок.